Welcome back to the Daily Brief. Good morning to you. Of course, we're going to be giving you a live update on what's happening in terms of around the country in the different counties as well. Well, right now, we'll be bringing to you the latest with regard to what's happening in Kisumu. We have our reporter, Baraka Karama, who's going to be giving us an update with regard to the latest in the health department. Now, yesterday, Kisumu Health County, of course, faced a lot of criticism regarding the fact that there was a stalemate of the health officials having not been paid since June. Now, the salaries have still not been received by these health officials. So yes, we'll be going to Kisumu County, where Baraka Karama is going to be giving us the latest regarding what's happening today. And of course, if there is an update and if the health officials have still down their tools or they're back to work.
Shiksha, the situation here at the Kisumu County Hospital is still worse. Remember, for the last 3 weeks, health workers within this particular facility have down their tools, demanding their salaries from May. And of course, we had an earlier press conference with the officer in charge of health and, of course, the CEC Finance, who said that plans were underway to pay the health workers. Right now, at this particular facility, of course, operations has been paralyzed. The wards are totally empty, and of course, on a normal basis, this hospital normally see an approximated population of over 500 patients who come from far-flung areas to seek treatment. But this has not been the case here for the past 3 weeks. Just allow me to get reactions from a cross-section of the union officials, what they think, and how this stalemate will be unlocked. Just welcome to the set. Just come. Okay, kindly, as one of the union officials, what is the situation so far? We can see the crisis is still on.
Okay, my name is Morris Adhiambo Petu, yes, the Kenya National Union of Nurses Secretary to Kisumu branch, yes, and with me are my colleagues, yes, from the Kenya Clinical Officers Union, yes, and from Kenya Medical Laboratory Officers Union. Yes. We are here to report to the public that we have reluctantly, yes, called off our 3 weeks long parade. Yes. We called off yesterday. Yes. This is informed by the fact that the county government of Kisumu started paying a portion of our health workers, yes, on Friday in the evening. Yes. And we are saying we reluctantly called off the parade because still a big number of our health workers have not been paid their salaries. Yes. They have not got their salaries from the banks which are supposed to pay them. Yes. This is informed by the fact that still the county government has not given the real money to the banks to pay the health workers. Yes. They made an administrative arrangements with the banks to pay with an overdraft. Yes. So we are saying that this is an indicator that there is inefficiency by the county government in managing the health workforce, the human resource in the health workforce. And this is impacting so badly into the health services of for Kisumu citizens. Yes. And as you can see, up to now, the services have not picked up, yes, because of those inefficiency. Yes. There's no way all of us can come and report to work while others have not been paid, yes, and others have been paid. Yes. It should be that when salaries are released, it is released for every health worker, yes, so that when we come to work, we report to all and work in harmony. Yes. But at this time, that is not done. So that is why you are seeing even the rate at which the services are picking up is, yes, quite slow. Yes. But all we can say is, to the public is that we have started giving services as at now, yes, and we have not been paid even the August salary. Yes. And we are still giving a notice to the county government, yes, that when it reaches the 5th of September, yes, before they pay the August salary, the following day, that is on 6th of September, yes, we shall go back to the county government's offices and start another parade, yes, for our salaries to be paid for the month of August.
And what is the situation in other public hospitals within the county?
The situation is the same. Yes. Our health workers reported this morning, and as they report, they have to do the arrangements in those departments before they start giving services. But I can tell you, and I can confirm to you, this is being done reluctantly because some of the health workers have not got their payments for July salary, for July. Yes.
So in the event that they don't receive their salaries, what will happen?
In the event that they don't receive the salaries, as their leaders, we are moving right away to the banks which have not paid. We are going to fact find and get the reasons and the first-hand information of what is happening in those banks, why they are not paying. Then we are going to engage the county government, the relevant officers, so that we can actually get to know why other workers have been paid and some have not been paid. In the event that there is no definite solution to that, we shall call off, we shall call out all the health workers now to start a strike.
So the situation now is that you've called off the strike officially.
Yeah. We have called off the parade. We were not on a strike. Yes. We were on a salary parade. Yes. And salary parade, immediately the salaries are paid, the salary parade should stop. So we just stopped the salary parade because a portion of our health workforce was paid. But in the event that every other person who was not paid by end of day yesterday shall not have been paid by end of business today, we shall inform our members on the way forward. And one of the way forward will be that we may call a strike for all the county health workers.
Okay, so when was the notice to call off for the parade issued? I can see most of the departments are under lock and key.
We officially communicated the call off of the parade yesterday evening. And it is not that some departments are locked. It is only that when we report after such a kind of situation, we have to meet as health workers in every department, organize the department, arrange the duty rota, and after that is when we start giving services. Okay. Yes.
Okay. Maybe you can get your comment. You're in charge of the laboratories.
Yes, I'm in charge.
And of course, this particular facility and other facilities within the county, we've seen a crisis in that particular department. What is your take about that?
Well, the crisis, as my colleague has said, has been informed by the fact that the county government is inefficient in paying its health workforce. Yes. It has partially paid. Yes. So those who are reporting are reporting, but they're doing it reluctantly. Yes. They come to work, but they're reluctant to work. Yes. Because some of them have not yet received their salaries. So that is why you are seeing the crisis, the departments that you're seeing. Okay. Yeah.
So what is the way forward now? Like your section said, if your demands are not met, yes, you're still going to
if our
carry
demands
on.
are not met, then definitely we shall now issue a proper strike notice. Yes. And go ahead and start a proper strike. Yes. At the moment, we had been parading. Yes. We had called off the parade, but then again, all our members are responding partially. Yes. Because, as I've told you, not all of them have been paid. Yes. But as he has said, we are going to the banks. We are going to do a fact-finding mission. Yes. We are also going to the county so that they can tell us what is their proper stand. You know, the county government of Kisumu is behaving very funnily. Yes. They are doing these things, but they have no proper channel of communication. Yes. So we are just like, we don't know exactly what they are doing. Yes. We don't know why some banks have been paying and some banks have not been paying. So that is what we are going to find out. And once that shall have been found out, our next course of action will be informed by the findings that we'll be getting from the banks. Yeah.
Maybe you can take your reaction. One last reaction, Shiksha.
Okay, my name is Kraus Okumodiambo, the branch secretary, Kenya Union of Clinical Officers. Yes. as my colleagues have said, that our members are reluctantly coming back to duty because some of them have not been paid. And to those who have even been paid, the statutory deductions have not been remitted to the banks. And some of our members are being blacklisted at the CRB because their loans are not being repaid. Yeah. So we just decided to call off the parade because we felt that the county had shown some commitment. So we wanted to reiterate with a goodwill that we care about the community and the people of Kisumu County. That is the reason as to why we called off the parade. And we decided to call off the parade. In case some of our members or the members that have not been paid, by the end of today, if we realize that they have not been paid, just as my colleagues have said, then now we are not going for a parade, but we are going to give a strike notice. Yeah.
Those were the union officials from Kisumu County, of course, giving us a brief on the latest update as far as the issue of the strike here in the Kisumu County Hospital is concerned. Like I mentioned, there's been a crisis for the past 3 weeks. A spot check that we've done earlier confirms that the wards are empty. All departments in this particular facilities are not in operation, and that of course has created a very huge impact as far as the health is concerned in the expansive county of Kisumu. Remember, it is not only this particular facility, but other parts for facilities within the expansive county of Kisumu where the health workers down their tools demanding their salary. So that's it. Like they mentioned, they've officially called off the parade, and of course they're issuing a notice to the county government to ensure that they live to their promise, failure to which they are going to call for another strike here in Kisumu. Back to you.
All right, of course, that is Baraka Karama from the Lakeside City. Now, as you've heard, the health officials have said that they have stalled and, of course, paused the parade, the salary parade at the moment, because the county officials have cooperated in their plight to get their salaries. And, of course, a few other things that they've mentioned is that at the moment, they've said, they've also mentioned that they will continue serving the people of Kisumu as long as the county officials cooperate to get their salaries and, of course, listen to the plight. And until they get further information regarding if some of the officials, some of the health workers have been paid, they will continue serving. And as soon as they hear that most of the workers have not been paid, well, then I guess after that they will take further action. Now, from the Lakeside City, taking to the capital city here in Nairobi, that is our reporter Lennox Sengre, of course, as he covers the story where businessmen have been evading taxes, and there is a crackdown that is looming on these businessmen who have been evading taxes worth billions of shillings. So right now, as you can see, Lennox Sengre is on Peponi Road, and he's going to be keeping us up to speed regarding what the next step is of KRA officials. Lennox, good morning. What is the latest?
Sure, Shiksha, at the Peponi Road, the tens of the DCI officers plus the flying squad have been camping at this place since 5 a.m. in the morning, trying to really find an access to this building you can see at my background, and the other home that belongs to an Asian who is running a company by the name Easy Limited. There are reports that he has been evading tax. Now the 23rd year, he has been in the business for 23 years, and he has been evading tax for the last 23 years in the history. And the DCI officers plus the flying squad officials have been camping here. They tried to access this place at 5 a.m. but they were denied an access. They moved to the other home that belongs to an Asian, trying to find out what is inside. Remember, from this story, this guy has been evading tax for 23 years, and they were saying that he is really putting notes inside his home. The amount of tax that he has been evading accumulates to over 1 billion Kenyan shilling. And inside his home, they are saying that he is talking billions of money which is not being taxed by the Kenya taxpayers, that is KRA, and they are still here. The KRA officials are also with them, the DCI and the flying squad officials. He denied them an access, but they gained an access at 7 a.m. this morning. Remember, these are raid that started at 5 a.m. in the morning, but they were denied really to access this building. And you also own another building that we have also traversed just next to this place. They have moved again back to that house really to know the amount of cash that is really being stocked inside. They are trying also to really find more information. Remember, the remitting of the old notes should end by 1st October. Now, this guy, from the information we have, is that Shiksha, he has been stocking a number of notes inside, and the KRA officials and the DCI plus the flying squad officials are trying to gain an access. If they will, then we'll know the development of this story as we get it. Shiksha.
Right, of course, that is Lennox Sanger. He's been giving us an update regarding an Asian businessman who has been evading taxes of up to 1 billion shillings that is in his home, stocking it up in his house. And of course, this is something that the KRA officials have been struggling with for the past few years. This year, KRA officials were not able to actually meet their revenue targets. And the reason behind that is because of a few unscrupulous businessmen who have not been paying their taxes in the entire capacity. And right now, taking you directly to Uasin Gishu County, as we had mentioned, that is DP Ruto, who inaugurated the palliative care center, the first of its kind. And let's listen in to what's happening from this particular ceremony. Well, of course, we apologize for that, and we will be giving you a more comprehensive update on this particular story in our subsequent bulletins, of course, in English. So yes, do stay tuned for that. For now, taking you directly back in studio, we have Samuel Njoroge, and he was going to be giving us more details regarding what he has in store for us in studio with the upcoming interview of the day.
All right, thank you so much, Shiksha Rora, for that. Indeed, it's less of an apology, more of appreciating diversity in terms of what is happening in Uasin Gishu County. But straight on, Edward Ouko finishes his term in office and would like to get a feel into what his final thoughts are as he exits the office of the Auditor General of the Republic of Kenya. So let's cross over there and listen in.
I think it's not, I don't want to nail suspect. I think he's working in a synergetic way, so that even as the DPP now takes the report, it's a solid report which is likely to stand before the courts. So that requires that we align the Auditor General, the other investigative institutions, and the DPP, and asset recovery. Do you understand in a way that they work in a seamless manner?
Maybe I get clarification. Did you say that you would want your report to be in such a way that once it's produced, no need of being, again, Parliament looking at it, another report is... Do you want it, for example, if it's done, forwarded to Parliament and action is taken immediately, or forwarded to the investigative agencies and with final and it's acted?
Yeah, what it is the interrogation of Park becomes almost like a court. Do you understand? It becomes like a court to say you are charged as so prescribed. Two?
Are you aware of any misappropriation of funds at Masai
I be aware of these things? I'm here in Nairobi. But listen, as I said, we go to Saimara at a point in time to go and look at the books. Okay? I don't have anybody seated in Masai Mara to be aware of that, but if it is there, let me know.
Just to follow up on this, because we got a report on our desk here that's saying that the allegations point out some officials in your office are receiving bribes to give a favorable report on the same.
Let me tell you, we will know right now if there is my officers, unless they're talking about other officers, if there's an officer on right now who is going to audit, we know right now the time the officer went, what the officer is doing, and we anticipate an output. Okay? Now, if that officer goes and sits there and cheats, that's another matter. But I think at that point the officer is being, do you understand? The compromising must come much later. Do you understand? When the reporters come. But the officers on the ground, they're raising issues. But that one I'm trying to tell you is now no issues which have been raised by the ground can be dropped. It may be dropped in the review, but we will, if there's an issue, we can raise them all again.
Finally, sir, do you think the cap on the 1 million withdrawals from banks has capped the corruption issue?
I don't know.
Just one last one from me.
Yeah.
In the Senate CPIC, they have involved an officer from the Ethics and Anti-Corruption Commission so that as they are probing the reports of the Auditor General, this officer of EACC listens in and maybe flags out some of those misappropriation questions. Do you think this is part of the larger process of ensuring that reports are actionable, the reports of the auditor are actionable, or as part of the proposals you're making, will this just go a long way in enhancing accountability?
I think already the EACC gets all my reports, and they have a system. So I think, yes, it's good for them to be at that level, but I thought maybe they can be called on us when needed, when the Senate feels there is something they're going to, because just, anyway, I don't know if you get me. I also have time. You know, today I've got a public lecture here. I hope you'll come. I got to prepare myself, and so much for the time. Yes. Enjoy your retirement. Yes. I think 2 is better. 2:15 you should be there, because then 2:30 we start. Yes. Okay. Now the print. Quickly. A minute to be in the same position. Yes. Yes. Yes.
Mwai Kibaki in the year 2011 appointing Edward Ouko for a term, as per the Constitution, for 8 years to be the Auditor General of the Republic of Kenya. And as he leaves office, he has this to say, that the use of the citizen accountability audits will make it possible for women, youth to participate in public audits. And of course, he leaves office at such a time when the services of that particular institution are much needed by the nation. But we do hope that moving forward, a substantive appointment will be made by the President of the Republic of Kenya. Right about now, would like to have a quick interaction with the Speaker of the County Assembly of Nyeri, that is John Kagusha, who joins us live right about now, and would like to interact with him on quite a number of issues, key among them how operations are within Nyeri County and how the County Assembly of Nyeri is addressing this particular situation. So thank you so much for joining us, Speaker John. If we can have him join us live. All right, I'm reliably informed that we take a break first, but when we return, we will be having Speaker John Kagusha.